Dr. Mihira, I'm calling about patient 321, Mr. Paul. He had a fall last night. He slipped and fell while trying to get to the bathroom. He complained of pain in his left hip.
Okay, Benny. What is his level of consciousness? Any signs of head injury?
He's alert and oriented. No visible head trauma, but I've monitored him closely for changes in mental status. His vital signs are stable, except for a slightly elevated heart rate.
Good. Order an x-ray of the left hip to rule out a fracture. I want to see him as soon as possible. Also, initiate fall prevention measures. Make sure his call bell is within reach, and consider using a bed alarm.
Will do, Dr. Mihira. I've already placed him on bed rest with side rails up.
Good. And Benny, please assess his risk factors for falls. Is he on any medications that cause dizziness or hypotension? Has he had any previous falls? This information will help us develop a comprehensive fall prevention plan.
Of course, Mihira. I want to reassure you that your wound is healing very well. There are no signs of infection, no redness, swelling, discharge, or increased tenderness, which is a very positive indicator. The edges of the wound have come together nicely, and the surrounding skin looks healthy and intact. This is exactly what we hope to see during the healing process. Regarding the stitches, they are typically removed between 14 to 21 days after the procedure, depending on the location and how well the wound is healed. A doctor will assess the site to ensure the skin has closed properly and that there's no risk of reopening. The removal itself is usually quick and painless, and you may feel only a slight tugging sensation. Once the stitches are out, we'll continue to monitor the area to make sure it remains clean and protected. You've done a great job caring for the wounds so far, and your body is responding beautifully. If you notice any changes or discomfort, please don't hesitate to reach out. We're here to support you every step of the way.